Ticks are on the move. Warmer temperatures could create more places where they can thrive in Indiana and give them more time to feed. All this could lead to more tick-borne illnesses in the future. But Indiana Public Broadcasting's Rebecca Theo reports without good data and communication, many of these diseases could go unnoticed.
Oh, I've brought out some of my medications that I used to have to take for Lyme disease.
Michelle Rawlings remembers getting bit by a deer tick while on vacation in Massachusetts about 8 years ago.
I had a very stiff neck and my shoulders hurt. There's pain radiating down my shoulders.
She suspected it might be Lyme disease, but it took numerous doctor visits to get a diagnosis. And then 3 years ago, Rawlings visited her sister in South Bend and helped in her garden. She then developed swelling in her knee and went to her doctor.
And I said, this looks exactly like Lyme disease. I've had it before and I've got it back again. And I said, I think I know exactly how I caught it. And he looked at me and he said, oh no, you can't catch that twice.
But Rawlings did test positive for Lyme disease with another doctor after hers wouldn't administer the test. Why don't many doctors know more about tick diseases? A lot of it has to do with a lack of information and the tricky nature of tick-borne illnesses.
If you get bit on your scalp, or if you get bit on the back of your leg, or you get bit somewhere where you don't see the rash, you could have had a bullseye rash, but you just didn't know that it happened.
Dr. Kimberly Lentz treats people with tick diseases in Zionsville.
So how you been doing?
Good. Had a couple 2 weeks ago, had 2 days where I literally couldn't go in to work at all.
Okay.
Dr. Lentz says part of the problem is how cases of Lyme disease are counted. The Centers for Disease Control and Prevention requires a positive test and certain symptoms. But Lyme disease doesn't present the same way in each patient. You might have any combination of flu-like symptoms, a bullseye rash, or even some heart and nervous system issues. And the antibody test for the disease can come up with a false positive or a false negative. If a patient has the right symptoms, the doctor might not test at all. Some tick diseases can be deadly, and it's best not to wait for a test.
We usually don't even do a blood test early on. We just simply treat them for presumed Lyme disease.
All this means is there's a big lack of data out there. And without data and information, doctors can't make informed decisions for their patients. But Indiana researchers are trying to help. Purdue University, Indiana University, and the University of Notre Dame are all working to track how ticks and their diseases move across the state. Purdue postdoctoral researcher Maria Morja places a female deer tick under a microscope.
You have a hard part in this middle part, it's called the sputum, and this doesn't have the sputum all the way, so when she feeds, can grow, can enlarge.
There are 3 main ticks in Indiana: the deer tick, the American dog tick, and the Lone Star tick, and their territories overlap. New ticks are also moving into the state. The Gulf Coast tick has been spotted in Indiana, and the invasive Asian longhorn tick has been found in 17 states.
Including Kentucky, just to our south. So we are concerned that it could move into the state and potentially become established in the state of Indiana. What we don't know is what it might be able to transmit, if anything, to humans.
Last year, Purdue surveyed doctors about their knowledge of ticks and tick-borne diseases. Hill says they found doctors knew a lot about how to treat tick illnesses, but not much about ticks themselves.
And so the gap is really in understanding where different species of ticks occur in the United States, or where they're most prevalent, when they become active, and where the high-risk places and times of the year are for the public in the state of Indiana.
For example, we know you're more likely to find a tick on you in the summer, but ticks are still active in colder months. Hill remembers this past October.
I walked the dog at a park, and I have, in the last couple of days, I've recovered 8 Ixodes scapularis, or deer ticks, adult deer ticks from the dog.
Hill says Purdue does what it can to get this info out, but she says it's hard to reach doctors. Dr. John Christensen is an associate medical director of infection prevention at Riley Children's Health in Indianapolis and teaches at Indiana University School of Medicine. He says he does get notices about new ticks, but it doesn't set off alarm bells for him.
Well, most practitioners will say, yeah, that's nice, but has the introduction of those, vectors has it led to an infection, right?
That's something they'll likely hear from their state or local health department.
Most people will pay attention to communications that are coming from the health department. And it may be coming from the state health department or maybe coming from the county where they live.
Health departments are often the only way to bridge the gap between doctors and tick researchers. That communication and good data could become more important than ever as more ticks and their diseases find their way into Indiana. Michelle Rawlings hopes more doctors will take the time to learn about tick diseases.
I'm really wanting to educate doctors that don't make this mistake. If you see someone in your office that has these kinds of symptoms, you should immediately test for Lyme disease and suspect that this could be Lyme disease. I don't want this to happen to anyone else.
For Indiana Public Broadcasting, I'm Rebecca Thiel.